Now coming to the advanced anatomy of the knee joint, axial image at this section. Yeah, we see something joining the anterior aspect or anterior horn of lateral meniscus with the anterior horn of the medial meniscus. What is this ligament called? It is intermeniscal ligament or transverse ligament. This is intermeniscus meniscal ligament or transverse ligament. If you see on the sagittal images, you can see here, this follow this band anteriorly. It's going and joining the anterior horn of lateral meniscus, anterior horn of medial meniscus. So this band is the transverse ligament or anterior intermeniscal ligament. So this is one ligament I wanted to show you. And as we know, a named pair of ligaments are there, which are meniscofemoral ligaments. So meniscofemoral ligaments, usually they start from the posterior horn of the posterior horn and posterior root of the lateral meniscus, and see, if you see, they go here. If you see this is anterior and this is posterior. Anterior meniscofemoral ligament and posterior meniscofemoral ligament, which is in relation to the posterior cruciate ligament. This is anterior to the posterior cruciate ligament and posterior to the posterior cruciate ligament. These dots, if you are seeing. So what is this called? Ligament of Humphrey, and this is called ligament of Brisberg. So Humphrey is hurry, so it's anterior. So this is Brisberg, which is posterior. So these are the meniscofemoral ligaments. Similarly, we should have something called meniscotibial ligament or coronary ligament. Meniscotibial ligament, if we see here, yeah, you see here, this band which is joining the lower inferior aspect of the meniscus with the tibia. This is our meniscotibial ligament or coronary ligament. So what is the importance of coronary ligament? When in case of trauma, mostly lateral meniscal thing. So if you see here, this is the coronary ligament if you see. So what happens when there is a depressed fracture or tear of this coronary ligament? We see something called floating meniscus. So we can see floating meniscus in case of coronary ligament tear. So that is one more ligament I wanted to show you. So that is here, the meniscotibial ligament or a coronary ligament. This is one more ligament. And then comes, if we go to the posterior aspect of the knee joint, okay, this is on the lateral aspect. Here we can see the popliteus tendon attachment. So this is the popliteus, yeah, this is the popliteus muscle. We trace it, yeah, if we trace it, it goes and inserts onto the lateral aspect of the lateral femoral condyle. You can see here, this is the fossa for popliteus tendon insertion. Okay, so in the posterior lateral aspect of the knee joint, we have the posterior joint capsule, which is reinforced, this is reinforced by arcuate ligament. So that is our arcuate ligament. And here comes the oblique popliteal ligament. This is an oblique popliteal ligament here. So these are the two important ligaments. We can see sometimes there will be breach in this oblique popliteal ligament with the extension of joint fluid into the posterior soft tissues. So there will be capsular breach and also breach of these ligaments. These ligaments usually reinforce the posterior joint capsule. So that is one thing. And if we see on a coronal image here, we see here, there is a popliteus muscle. This is a popliteus muscle. If we see, there is a small band which is connecting this popliteus muscle with head of fibula. If you see here, this small fan-shaped band is popliteofibular ligament. This is a popliteofibular ligament. This fan-shaped ligament, small fan-shaped ligament, is a popliteofibular ligament. So these are few ligaments which I wanted to tell about. What is this ligament? Is this really a ligament? No. This is the biceps femoris muscle. This is the tendinous insertion of biceps femoris that is getting inserted onto the head of fibula. So if there is a trauma, we can see if the avulsion is happening at the biceps femoris insertion or lateral collateral ligament attachment. Based on, it can be both also, based on which is taut and which is torn and wavy. Okay, then this is about the lateral aspect. We discussed muscle on the lateral aspect is biceps femoris, that's tendinous insertion, lateral collateral ligament, popliteofibular ligament. Then coming to the medial aspect, I'm going to show something on the axial sections. So if you see here, what is this? This is called, this is the bursa, usually in case of osteoarthritis, and sometimes because of repeated uh, what do you say, shear strain, people will explain pain in the medial and posterior aspect of the knee, just below the knee joint. So this is a pes anserinus bursa. What is pes anserinus bursa? Pes anserinus bursa is a bursa between these three tendons, which are getting inserted onto the proximal aspect of the medial tibia. So what are these three tendons? Sartorius, gracilis, and semitendinosus. Sartorius, gracilis, and semitendinosus. So this is called pes anserinus bursa. We can observe there is minimal fluid right now, which is normal. So usually bursal thickening will be there, bursal walls will be thickened, and soft tissue inflammation and fluid. So pes anserinus bursa, these three tendons are called what? They are called gyropes. So why they are called gyropes? Gyropes, usually the gyropes are the ropes which hold the tent. If you see the tent, if say this is a tent, so these three ropes hold the tent. So what is the tent in this case is our hip. So hip is being, and it is seen like that hip is being holded by these three tendons, beautiful tendons, sartorius, gracilis, semitendinosus. Why? Because if you see sartorius, it starts from anterior superior iliac spine and gets inserted here anteriorly. So this is from the anterior superior iliac spine, which is the extreme anterior part of the ilium. So then we have gracilis, which starts from the body of pubis, so which is almost like the midpoint of the pelvis. So next, semitendinosus, it starts from the ischial tuberosity. So ischial tuberosity is the posterior aspect. So these three tendons acts like ropes which hold the tent. So they are called guy ropes. And the bursa, we see in between these three is the pes anserinus bursa. Okay, pes anserinus bursa. So what is this then? We have thought about these three muscles. That is okay. And what is this? What is this? This is our semimembranosus. Why semimembranosus? It inserts like a membrane, gives multiple insertions. It also reinforces and joins our oblique popliteal ligament medially. So this is our semimembranosus. Then if we go a bit superiorly on either sides, if you can see, there is some muscular origin happening here, and there is one more muscular origin happening here. These two are, this is the lateral head of gastrocnemius, this is medial head of gastrocnemius. So this is a gastrocnemius muscle. This is the popliteus muscle. If we still go down, we can see this is our soleus muscle. So these are the posterior muscles. I've shown you the medial, lateral, posterior, and also anterior. This is all about the anatomy of the knee joint.